I'm very happy to introduce Dr. Randy Katz. Randy's a new member of the Heads Board of Advisors this year and serves as the Medical Director for Emergency Services at Memorial Regional Hospital. More importantly, he's the father of 3 U School students. Randy will answer some questions at the end of his presentation, so please send any questions you have to the chat box and they'll be addressed at the end. So I will turn it over to Randy Katz.
So thank you for the warm welcome. As Dr. Kopis mentioned, my background is in emergency medicine. I'm the chairman of emergency medicine at Memorial Regional Hospital. I'm also a medical director for City of Pembroke Pines Fire Rescue and the City of Hollywood Fire Rescue, as well as AMR private ambulance. So I have a lot of experience in that area. Although I'm not an infectious disease expert, I have both treated patients for the past 6 months, developed protocols, and published a few research papers on COVID-19. So I'm very familiar with the virus, the challenges that we face both in the hospital and the community. And I'll share with you some data and some advice and guidelines that I suggest or that I propose from the standpoint of managing the virus. I will start by saying that all 3 of my children are in school, physically in school, and the leadership of the school has done an outstanding job preparing the school, both teachers, faculty, and the students, for the safest environment that we can create. And we have to realize it is not a perfect environment. Perfection is unattainable, but we are very privileged to have a safe place to send our kids to school, because I can tell you, as you can see from the news, the public healthcare system, public school systems are really having a challenging time opening schools. And there's some cities around the country that are not opening until the end of the year. So before I present some data, I just wanted to talk a little bit about transmission. And I think it's important to understand how the virus spreads. This is a respiratory virus. The primary mode of transmission is through respiratory droplets. The CDC actually, some of you may have seen in the news this week, the CDC may have this week pulled back some guidance regarding this topic. But this is a respiratory virus. It's transmitted through the air, through the nasal and oral passage. The concept that it lives on surfaces and spreads on surfaces, although it can happen, very limited spread in that fashion. This is a respiratory virus that spreads through the air. Whether it's small droplets, aerosolized droplets, there's some controversy, but clearly this is a respiratory virus, which is why masks are so important. Some risk factors with respect to transmission: clearly prolonged contact. So sitting in a room for an extended period of time without a mask with somebody who has this infection, extremely likely you'll transmit this virus. This is one of the most transmissible viruses that we've ever experienced contact with. So this is a very easy virus to spread, as most of you know. Anywhere indoors with poor ventilation, that's considered a high-risk environment. And restaurants and bars, a lot of the recent research has shown that new virus infections, if you take a poll and talk to people, and most of these people have been in restaurants and bars in the past few weeks prior to receiving this virus. So usually within a week or two, roughly 50% of the new virus infections, when they polled those individuals, they were in a bar or restaurant in the past 2 weeks. And obviously parties, gatherings, social events, particularly with teenagers, as you can see from most of the college campuses, this is a very high-risk environment as well. It's important to wash hands and keep in mind that the surface spread, it happens through touching a surface and then touching either your nose, your eyes, or your face. So with the kids, it's extremely important for them to wash hands frequently, and hand washing is definitely a key component, but it's really important to understand that this is a transmissible virus through the air, not through surfaces. It doesn't necessarily transmit from touching something. It has to be touched and then transmitted to your face. So both areas are ways that the virus can be transmitted, but respiratory is the primary mode of transmission. This slide's a little bit blurry, but I wanted to share this because this is actually data from our healthcare system. And the gray bars are overall emergency department volume. The green bars are the number of patients that were tested and tested negative. And the red bars are the number of patients that were tested and tested positive. And as you can see, if we go back to April, there were patients testing positive, but the numbers were very small. And this spike here at this point in July is really the height of that surge we saw in July. And as you can see, we're still seeing positive patients in our emergency department, although that number is much lower than it was in July. This is data from the state level. And one of the things I would point out is if you look at these gray bars, clearly in July we had a spike. But what you see now in the state, and a lot of this is obviously different cities and different areas of the state, is you see a plateau. So what you're seeing is the data showing that the virus is transmitting, but it's at low levels, but it's really not coming down to very, very, very low levels. This is basically a plateau of virus transmission. And on the left in the red, you see the positivity rate. And 5% is really the number we need to be at in order to have a safe environment to go back to school and go back to normalcy. And as you can see on a state level, the positivity rate is still around 6.5%. So we're not quite there yet from a state level. Now, in Broward County, we've actually done a better job, or at least recently, the positivity rate is lower than the state level. And as you can see in the bottom left-hand corner here, we're right about 5%, which is where we want to be, minimum threshold for going back to school and going back to some normal activities. But what you see is again a plateau, and I think we're at a very crucial time where the transmission of the virus is still there. We've somewhat plateaued where we're at on a state level, and in Broward County, we're starting to see a plateau where the numbers are really not coming down significantly from where we're at, although we're in a much better place than we were in July. This is an important slide because it does show with elementary, middle school, and high school, positivity rate is still very high. So although the overall positivity rate in Broward County is about 5%, in the pediatric population, it's about 13%. So 13% of the kids that get tested are positive for COVID-19, which is a very high number. And this bar above this green area are high school age children. And you can see the majority of kids testing positive are not the little ones, it's actually the teenagers and the high school kids. And this is just another depiction of that, showing the age groups. And as you can see in the state of Florida and Broward County, the numbers of positives, most of those positives are between the ages of 15 and 34. The good news is, kids do very well. Early on in Europe and New York City, mortality rates were somewhere along the lines of 5%, even up to 10%. But we now know that the overall mortality rate is somewhere along the lines of 0.3 to 0.5%, which is low, a little higher than influenza, but nevertheless, a very small percent of patients do die. And as you can see in the younger age groups, with kids, kids do very well with this virus. It's the older population, as most of you know, that suffer. And the risk is really these kids bringing these viruses home to our families and our parents and grandparents. So that's the risk that we take on as kids go back to school. This just shows different states and where things are at across the country. And as you can see in the bottom right, state of Florida, we're in a much better place. There's some places around the country, particularly North Dakota, South Dakota, Utah, where they're starting to see a significant surge. I shared a couple slides from a few other countries, and these are actually through, I think, 2 days ago. And these are 7-day averages of new infections. And as you can see in the United States, we're starting to increase again the 7-day average. So we saw a significant improvement from July to early September. And as you can see, we're starting to see an uptick again. Countries like Israel on the right have seen a significant surge in September, and Spain and France and other countries in Europe, as you know, are seeing a significant surge as well. So this virus has not gone away. Anybody that thinks that we're in a really great place right now and we're safe is misguided. This virus is still out there. It will continue to spread until there's a vaccine. And it's the challenge is really trying to mitigate and find ways to control spread. So this is the most important slide in the lecture, and I wanted to talk a little bit about prevention and our responsibility as parents with children either in school or at home or socializing outside of school. Masks are clearly the most important component to mitigating virus spread. And I'll talk a little bit about the types of masks because there's a lot of questions and controversy over mask use, but clearly masks are the number one thing. And as Dr. Kopis mentioned, it's really important for the kids in school to wear masks at all times while they're in contact with other kids in a closed area, and even outside. So I can't stress that enough. And that's true for, outside of school, in public places, anywhere where, kids or parents are in contact with anybody else. I think we've got the message on that, and it's been pretty clear the past few months. Maintaining 6 feet, and I can tell you the school has done an excellent job at distancing kids. It's not a perfect environment. There's going to be times when kids are less than 6 feet together walking a hallway or crossing paths in a hallway, especially in high school. But they've done an extremely good job of maintaining that 6 foot distance in the classrooms and while they eat. So kudos to the school system. Obviously avoiding public places, small groups. One of the things that I've done with my kids is really try to maintain a bubble with their group, and if they have a couple kids that they socialize with, trying to make sure they all follow the same rules and stay within that same bubble. It's not always possible, but sort of maintaining somewhat of a social bubble is a really key way to control spread both in and outside of school. And testing and tracing is really important. We talked a little bit yesterday about what happens if a child tests positive and we find out about it, in school. The school does have a system in place, and Dr. Kopis can probably talk about some of the policies and what happens when a child tests positive. But clearly, testing is extremely important, and I'll talk a little bit about the types of tests because there's a lot of misunderstanding and controversy over what types of tests to use on your child or yourself, and how to access that. And I want to talk about social risk and school risk. Quite honestly, the risk in school of transmitting the virus is much lower than the risk of a child acquiring this virus out, socializing in the community. The school, in my opinion, although it's not perfect, is a much safer environment than the soccer fields or the grocery store or other places where the kids are in contact with the general public. And it's our responsibility as parents to have enough social responsibility to do the same things that we would all expect to do outside of school. And that includes, limiting the number of people your child's in contact with, making sure that they're wearing a mask at all times, washing their hands religiously, when they're out in public, and really following all of those CDC guidelines that are out there and have been well published. And one of the important things is to really recognize subtle symptoms in children. And adults as well. I can tell you I've treated, probably a few hundred patients with COVID-19, or maybe more than that. And the symptomatology is all over the map. I've had, people just complain of feeling tired and test positive. As we know, there's asymptomatic people. And so if your child's complaining of a headache that doesn't seem right, or they just seem tired, you should have, a high index of suspicion, and really not send that child to school until they're tested. And that requires testing. You can't really guess whether the child or yourself have this virus. You have to get tested. So just be aware, things like, fatigue, headache, just, mild runny nose, that type of thing. Those are symptoms that kids tend to have with COVID-19. They don't get really sick, and they're not going to complain of a cough most of the time. They may run a fever, they may not run a fever. But if you notice that your child's just not his or herself, and they just don't seem right, I would definitely 100% consult with your pediatrician. Avoid sending them to school at all costs. And it's up to us as parents to have that responsibility to keep the other kids safe at school and make sure our children get tested when indicated. And I can't stress that enough. I mean, that's the key to success in school. So I'll talk a little bit about masks. There's really, three types of masks that are in use out there. In the hospital, and most of you are familiar with the term N95. From a scientific standpoint, N95 masks, they basically filter out 95% of particles that are less or more than 0.3 microns. So to put things into perspective, COVID-19, the virus itself is about 0.12 microns. However, the virus has to travel on a droplet or a small, aerosolized droplet that is expelled from the airway And when you measure that droplet with the virus, it's somewhere between 0.5 and 1 microns. So the N95 mask will essentially eliminate 95% of that virus in the air. KN95 is really not much different from an N95 mask. KN95 masks are basically, the Chinese version of the N95 mask, and work just as effectively. Then there's the KN95s that have a valve, and I would just caution, obviously sending a child to school with a mask like this with a valve is a big no-no. The valve is an exhalation port, so if the individual wearing the mask has the virus, they will expel that virus through that valve into the air. So any of these masks that have that valve, although it may protect the person wearing the mask, if that person wearing the mask has the virus, it will transmit that virus through the air wherever they go. So these are masks that we should not wear in school, and if there is a valve on any of your masks, you probably should look into a plain KN95 mask or another form of mask or facial covering. And then on the right, you've got cloth masks, which filter out about 2.5 micron size particles. And those little filters that go inside these masks do filter out a lower micron size. However, these masks are not perfect, and they're not really equivalent to N95 masks. There's all different versions, Nike, Under Armour, Athletica. You can buy all types of cloth masks online. They do filter out virus, although it's not 95%. And so we all don't have access to N95 masks. KN95 masks, obviously are not that accessible either, and some kids and parents have them. And cloth masks are okay with these filters inside of them. And understand that from a scientific standpoint, a cloth mask is not perfect, but the transmission of the virus is dramatically reduced by wearing any type of facial covering, whether it's cloth, KN95, or N95 mask. And cloth masks, as long as there's a tight seal around the mouth, around the face, and keep in mind that these masks all have to fit. Sometimes, especially the KN95 masks, in children, they're a little too big. And there are different sizes. There's a regular and a small usually. So it's important to make sure that the mask sort of has a tight seal around the face so that, virus doesn't escape or, air doesn't transmit through sides of the mask. So making sure that the mask fits appropriately is really important as well. And again, none of these masks are perfect, but we know that any of these masks, and there's a spectrum of efficiency, but all of these masks do dramatically reduce transmission of the virus. I'll talk a little bit about testing, and there's a lot of controversy and misunderstanding about testing, and I've done a lot of work and published some research on testing, and I actually do testing myself from a private perspective. There are antibody tests, and these are tests that essentially measure proteins that circulate in your blood once you've been exposed or infected with the virus. I would highly discourage using antibody testing at all for any diagnostic purposes. It's essentially useless from a diagnostic standpoint. There's a lot of, sort of black market antibody tests out there, and I would say essentially antibody tests are useless from a public healthcare standpoint. Right now, we don't do a lot of antibody testing in the hospital. There's very few, situations where we would use antibody testing. And these small test kits are really not something that anybody should be using to make a diagnosis. In the middle, you have antigen testing, which essentially the antigen testing is looking for this protein on the surface of the virus known as a spike protein. And there are all types of antigen tests out there. And these are these rapid tests that can take anywhere from 5 to 15 minutes. Some of them are on a little cartridge that's put into a little machine, as you can see in this picture. They can be done on site, let's say at a summer camp, or even in a school system. These tests are not that accurate, although they're more accurate than antibody tests. They should never be used from a diagnostic standpoint. So if your child is sick and you take it somewhere to get tested, if you're using one of these rapid tests that is an antigen test, that is not the way a child should be diagnosed with COVID-19 or an adult for that matter. These tests are sensitive somewhere in the range of 75 to 85%. And they're very good for looking at large populations and screening out, a large portion of individuals that may have the virus. But from a diagnostic standpoint, these are not tests that should be used if your child is sick or symptomatic. So be very careful with using these rapid tests and ask what type of test is being performed wherever you take your child. The gold standard and the only test that should be used from a diagnostic standpoint is what's called a PCR or molecular test. And these can be done by a nasal swab. Saliva testing is actually just as accurate as nasal swabs, and oral swabs as well. And these are tests that have to be done in a molecular laboratory. There are a few products out there where it can be done on site, but these are typically machines that are only available in hospitals. There's a couple machines out there that can do this test in 15 minutes, and they're not quite 99% sensitive, but they're pretty close. But these are not the typical rapid tests you're seeing out there in the community, in some of these urgent care centers and places that people are taking their children to be tested. So it's really important. I think testing is an extremely important component to controlling spread, particularly in the school. So if your child is sick, again, make sure that they get a PCR test. There should be no other test done if the child is symptomatic. Here's a picture of the state of Florida, and as you can see, one of the things I wanted to show is the testing numbers have come down. Not only the individuals that are testing positive, but the number of people being tested, and that's not a great sign. I think testing is a real key component to containing spread of the virus, and we've seen less and less testing on a state level, and in our own healthcare system as well. So again, any mild symptoms, if your child's not feeling right, I would highly recommend getting your child tested. And again, make sure it's a PCR test. A little bit about vaccines, because I know this is a hot topic, and I'll mention it really quickly. I'm not an infectious disease expert. Again, I'm an emergency room physician and have an emergency medicine background. But I wanted to show you the complexity of these vaccines and why there's so much to discuss. Most influenza vaccines are what we call whole virus vaccines. So these are inactivated influenza virus particles that are injected into a body, and the body identifies that as an inactivated virus and produces antibodies. That's your traditional influenza vaccine. The vaccines that are currently being researched and looked at for COVID-19 are not whole virus vaccines. They're using genetic material, sometimes DNA. Inovio is one of the companies looking at DNA. RNA is Moderna and Pfizer. Those are the two companies looking at RNA. And these are essentially vaccines that have never been used in humans. There are some other protein-based vaccines that have been looked at for COVID-19 and are being developed. And so what you'll see as some of these vaccines come to market is there are different types of vaccines and different classes of vaccines. But the one that I'm really interested in is the RNA and DNA vaccines. These are genetic vaccinations that both affect antibody immunity as well as T-cell immunity. And again, these are vaccines that have never been used in humans or are successfully used in humans. They've been studied, and they currently don't exist in any other disease from a vaccination standpoint. So they can be produced very quickly and manufactured very quickly. They can be made in a laboratory essentially in days. So if they are successful, and again, there's a number of studies at the University of Miami. I believe there's a study with over 30,000 individuals with a few of these vaccines. And so over the next few months, you'll probably start to see some of these vaccines come to market. My suggestion is, pay attention to what type of vaccine you're getting. There'll obviously be a fair amount of research published when these vaccines are approved by the FDA. And we're probably looking at least a couple months before we see anything on the market. And I would imagine the RNA and DNA vaccines will probably not be available until early next year sometime. You'll probably see the protein-based vaccines and maybe one of these viral vector vaccines available towards the end of the year. And that would probably be the one I would wait on. And, just kind of give it a little time. I wouldn't jump at the first vaccine available. I would analyze the data, and really wait until there's options out there to see which vaccine is most effective and safe. And what do we expect in fall? Unfortunately, I think there's a very high likelihood we're going to see another increase in COVID-19. You can see from the data, there's a plateau. The virus is still circulating. Just to put things into perspective, the positivity rate in Broward County is hovering around 5%. In Palm Beach County, it's actually ticked up from 5% to 6.5% the past week. And in New York City, they're still below 1%, and they're not opening schools. So just to put things into perspective, 5% versus 1% in some cities, we have a long way to go before this virus is really contained. It's important to understand that, and it's important to continue not letting our guard down and being complacent about what we do in the community with our children. Obviously, there's sports, socialization. I mean, I know the mental health toll, both on kids and adults, has been significant, and it's a balance. You know, and going back to school and bringing kids back right now, I don't think it's premature, but it's definitely not 100% safe, and we have to keep that in mind. And again, there is no perfect environment. We're not going to get down to 1% anytime soon. And we have to understand where we're at in the life cycle of this virus, and we're at a very crucial time, and it's up to us as parents to be socially responsible, making sure that we're educated, making sure we get our kids tested. And again, we're extremely fortunate to have the option to send our kids to school in person in what I would consider a very safe environment. With regards to influenza, you know, in the Southern Hemisphere, usually in Australia and places in the Southern Hemisphere, flu season's already passed. And in those areas, there has been essentially no flu season. And that's mostly because of lack of travel and wearing masks and things of that nature. So it's questionable whether we'll see a significant flu season, but now is probably a good time to get the flu vaccine between September and late October. Whether we'll see influenza and whether it's going to be a significant issue and overlap with COVID-19, I think it's an unknown. We don't really know what we don't know at this point. But my guess is the influenza season will probably be extremely quiet just because of some of the infection control precautions we put into place. We will see vaccines available within the next few months, I'm sure. It'll probably be some of the early, less sophisticated vaccines. I mean, I personally would recommend just waiting until there's enough options out there to weigh which is the most effective option. What we don't want is to get one vaccine and then it prevents you from getting another one that's more effective. So you may want to wait a little bit just to see, you know, the efficacy and the safety of some of these vaccines when they come out. And I think you're going to see intermittent lockdowns. You know, we may come to a point in December where our community sees a positivity rate of 10 or 15%, and we may have to, you know, revert some of the things we've put into place, and that includes school. So I think we have to be prepared for that. I know that the school system, from a tech standpoint, has done an amazing job of giving us the option of educating our kids at home. And should things come down to that, it may come to a point where the kids all have to go back home for a bit until we can get the numbers back down again. We see what's going on in England. You know, they went back on another lockdown, or what they call restrictions. And that may happen in the United States and South Florida. So we have to be prepared for that and be realistic and understand that I think we're going to see another increase. It's just a question of the amplitude of that curve and how quickly this virus is going to spread. And just one thing to keep in mind, that this problem, unfortunately, is not going to go away. This is just a nice picture of all the different infectious disease issues that we face, you know, in the world. And whether it's COVID-19 or H1N1, Ebola, MERS, we're going to continue to see viral outbreaks, and the frequency of these viral outbreaks is becoming more and more frequent. So, you know, whether it's COVID-19 or something else, we do need to probably keep in mind that at some point we'll be dealing with something else. And a lot of the things we're learning now and doing will probably carry over into other infectious diseases during our lifetime. And with that, I'll end the lecture, and I'm more than happy to answer any questions that are you know, floated out there today.
Well, first of all, Dr. Katz, thank you so much for your time today. Thank you for your presentation. It was informative. It was educational. I think we can all agree it was sobering as well. More importantly, thank you for your service. Thank you for putting your own health at risk to serve our community and leading others in the healthcare industry to do the same. I think we all have an appreciation for our doctors and our nurses and our first responders who, again, are putting their own health at risk every day to serve the community. So thank you. We do have a bunch of questions that came in, so I'm just going to jump right in. Referring back to one of your earlier slides, somebody had asked what the spike was on August 31st. It looks like in all the graphs, there was a big jump in Florida cases on August 31st. Can you speak more to that?
Yeah, so, you know, that's right around the time we started to see a significant increase with transmission of the virus in the community. July was clearly the peak of that surge, but towards the end of August, obviously we had some holidays that you know, May and June, and a lot of that transmission. Keep in mind that, you know, you don't really see the effects on a larger scale until weeks after, you know, changes have taken place in the community. So I think that August spike was really related to, some of the holidays and activities when we let our guard down. Remember back in June and May, things were fairly quiet, and there was a lot of controversy over whether, you should wear a mask or whether you had to wear a mask in public. And I can tell you that mask adoption took some time. And I think that spike really was the early indicator that this virus is transmitting actively in our community. And that was, obviously, August is a little bit after July, but I don't know exactly what slide you're referring to. I'm thinking, it's related to the July spike, for the most part.
Okay, thank you. A lot of questions about flu shots. So do you encourage everyone to get a flu shot this year? And would that have any effect on preventing COVID symptoms?
The flu shot is recommended. I would recommend getting it. I don't think there's any downside. Some people do develop side effects, maybe some body aches, maybe even low-grade fevers following the vaccination. I would definitely recommend getting the flu vaccine. It's going to be challenging if there's an active flu season to differentiate who has COVID-19 and who has influenza, and anything we can do to reduce transmission would be helpful. And I don't think there's a lot of downside to getting the influenza vaccine.
Okay, thank you. So this is going back to vaccinations. Some people are struggling with the decision, to take the vaccination because nobody really knows what the long-term effects will be. And so do you know, in parallel, are they creating sort of remedies to treat COVID?
Well, remember that safety is the first thing they look at with vaccinations. So phase 1 studies are really focused on safety. And we've gone through phase 1 studies in a lot of these vaccine trials. So I think the vaccines have been shown to be pretty safe at this point if they're moved into phase 3 trials. The phase 3 trials are really about efficacy and whether or not they're effective at reducing transmission of the virus. These newer genetic vaccinations, these DNA and RNA vaccines, are really injecting genetic material that's basically produced in a lab into human cells. I don't think we know the long-term impact of that. Anytime you manipulate genes and genetic material, there's always a risk of, different types of cancer and things like that, and genetic mutations. So I think that's the fear with some of these genetic vaccinations, is that as you manipulate people's DNA and RNA in their cells, what are the long-term implications? Can they develop some type of blood cancer or mutation that leads to some type of cancer long-term? We don't know the answer to that, and I don't think we're going to know the answer to that anytime soon. It's going to take years before we know the answer to that question.
Okay. So you spent some time talking about masks. What's the best practice for cleaning cloth masks or disposing of N95 masks? And does cleaning cloth masks impact any of the effectiveness?
Yeah, so these filters are very sensitive to, the filters that are in the cloth masks. Those need to be changed relatively frequently. Anytime you clean the cloth mask, make sure you remove the filter. The filter cannot be cleaned with soap and water unless, it's some type of filter that I'm not familiar with. But all of these masks are, the filter material is susceptible to water or soap or anything that disrupts the integrity of the filter. The cloth component of the mask, obviously, look at the label. I'm sure those can be washed. It's the filter that really can't be washed or manipulated. Filters can be used for days, even up to, I would say, a week. In the hospital, early on, because of the supply constraints, we were using N95 masks sometimes for days. And there's nothing wrong with that. The integrity of the mask is important, but as long as it's not soiled or damp or wet, a mask can be used for a number of days. The filter can be used for a number of days.
Okay. We have some parents in the school community who are expecting. So are pregnant women more at risk? And what's your opinion on pregnant women getting a flu shot?
There are certain types of flu shots, anything that's an inactivated, or active type of flu vaccine. You have to be careful when you're pregnant. And obviously it's something I would discuss with your OB/GYN before you receive the vaccine, because it depends on what type of vaccine you're getting. With respect to the virus itself and pregnancy, we have not seen a lot of issues with respect to the fetus. So if a mother's COVID-19 positive, we've seen a lot of mothers have bad outcomes, just as any other adult. There's probably a slightly increased risk to a mother who's pregnant having a bad outcome with COVID-19, but we have not seen a significant impact on the actual fetus. We don't think that the virus is transmitted through the placenta to the fetus. Whether there are any long-term implications, we don't know. But I can tell you we've had a number of COVID-19 pregnant patients admitted to our hospital who have delivered and really have not seen any negative impact on the fetus. Now, we've had a couple mothers who have not done well, and have had very bad outcomes while they were pregnant, but that's no different than any other adult. But I do think, based on the literature that's out there, that pregnancy does increase risk to the mother, not so much the fetus.
Okay. So as you mentioned before, University School has been vigilant in making sure that our students are wearing masks at all times, with the exception of lunchtime. So what would you recommend for preventing the spread of COVID when students are able to take off their masks for lunch?
Yeah, sure. So, again, it's not a perfect environment. Kids need to eat. Ideally outside would be the most ideal, environment to eat lunch without a mask, if that's possible. If it's not possible, then I would recommend small pods of kids, anywhere from, 3 to 5 kids spaced apart in a large room, if possible, and trying to make sure that the kids are, in a small pod spaced apart inside. You cannot, mitigate virus spread without a mask, but you can definitely spread kids out and keep them in small groups. So that's what I would recommend. Again, as a faculty and leadership in this school, I've been extremely impressed with the way, all of this has been managed. And, I talk to my kids when they come home from school, and they've given me all the right answers. So I think the school's done a great job of setting up that environment for success. But keep in mind, it's not perfect, and we cannot create a perfect environment. It's just not possible.
So somebody heard that you cannot have both viruses at the same time. Can a person have COVID and the flu at the same time?
Sure. Actually, you can have influenza A and influenza B. You can have 2 flu strands at the same time infecting somebody. So I've seen patients with both influenza strands at the same time. And you can definitely have influenza and COVID-19 at the same time. Both of those are possible.
Okay. All right, so your thoughts on use of playgrounds. So in the lower school, we have all of the playground equipment closed to the students. Do you think that children could use the playgrounds if they're wearing masks and socially distancing and washing hands, either before and after? Or is it best just to keep the playgrounds closed for our lower school students?
Yeah, that's a good question. I think there's been a lot of overkill with surfaces. I think some businesses have been cleaning surfaces every 2 hours. Surfaces are important. Again, the virus doesn't typically primarily spread through surfaces. It's an airborne virus, and being outdoors is clearly the lowest risk environment you can create for a kid. The way it transmits from surfaces is when you touch a surface and then you touch a mucosal surface of your body. That's whether it's your eyes, your mouth, or your nose. So in theory, if a kid's wearing a mask and they're touching a surface, as long as they're cleaning their hands before and after, I don't think there's any reason why a kid can't go out, and play on a playground and do some of those things. As long as they're wearing a mask and covering their face and mouth, and they're washing their hands before and after religiously every time they're out there. But I think it's something that's totally reasonable to do.
Okay. We have a couple more questions. If the kids are wearing their masks but not socially distancing, is that enough safety? So for example, her children are virtual and she knows that social distancing at all times is pretty much impossible, but wanted to know if that's okay as long as they're wearing their masks.
I think about a picture I saw in the Sun Sentinel last night of a school, I think it was in Boca or West Palm Beach, where there were about 100 kids packed into a hallway on the first day of school. I think it was somewhere in Palm Beach. So, you're going to pass somebody in a hallway in a very close proximity, especially in middle school and high school. There's going to be times when you're less than 6 feet apart. As long as you're wearing a mask and the distance is a very short period of time, less than 6 feet, I think the risk is low. Keep in mind that I work in a very high risk environment. I wear a mask, and no different than maybe some of the masks the kids are wearing to school. And I walk in rooms and examine patients who have COVID-19 and it's circulating in the air, and I'm less than 6 feet. So I do it all the time, and thank God, I have not had COVID-19. And we do that all the time in the hospital. But as long as you're wearing a mask and you're following protocols, and obviously limiting the amount of time you're in close proximity to each other is important. But again, you're going to have times when kids are close together, crossing the hallway, changing classes, and that's, you know, reasonable as long as they're wearing a mask. I think it's fairly safe.
Okay, and just wrapping up the Q&A, I guess it's going back to the vaccinations. And do you feel that we would still have to wear a mask after getting vaccinated?
Yeah, because, you know, the problem is that we don't know who's been vaccinated and who hasn't. And there's this social piece to mask wearing where, you know, if people stop wearing masks, you know, the people that have not been vaccinated may feel less inclined to wear a mask. And I think there's a social responsibility we have to have. And it goes back to people that have had COVID-19, right? I mean, you know, should they wear a mask, or is it okay for them to not wear a mask if they've already had it? And I think it sends a very negative message to the community, you know, not wearing a mask until this virus has been eradicated or reduced to extremely low numbers, where it's not really transmitting in the community. So I think, you know, regardless of the vaccine, you know, we need to wear masks all the time.
And in follow-up, what's your position on wearing masks while outside?
You know, if you're in close proximity to other people, I would suggest it. You know, obviously outside, again, this is an aerosolized or you know, airborne virus. So outside, it's much safer. You know, if you're out there jogging and you're by yourself, probably no reason to wear a mask. But if you're around other people, you should, whether you're inside or outside.
Okay. All right. Well, I just want to thank you again for your time and for your service. Are there any other questions, or Danielle, do you have any closing comments?
Thank you so much. It's been incredibly informative. We appreciate your time. We know how busy you are, so I really, really appreciate it. Thank you, Randy.